All right. We are going to get our program started. Thank you all so much for being here. It's sold out, as you can see, the hottest ticket in town right here. Yes, thank you all for being here. Thank you for coming down. Thank you for circling the parking lot for 45 to 60 minutes looking for parking. We really appreciate that. My name is Fred Northup Jr. I am thrilled and honored to be back here with you as we celebrate this year's Global Health Impact Awards. You can see we've got 3 cameras. We are streaming right now live on YouTube, and normally we would not expect a lot of surprise viewers, but I've been told that with the Hollywood strike shutting down so much production here in the States, that we are officially the most exciting content on YouTube at this moment. So, hello, new viewers. I don't know how many exactly we would have, but I have also been told that we will have a lot more viewers if one of you would just take the time and date Taylor Swift. So if you could just find someone, nominate them, that will make us go viral in a big way. So who is here for the very first time at these awards? Welcome. Let's a round of applause for the new friends here. Thank you. The new people don't know. Those of you who were here last year, you'll remember that the most exciting, nerve-wracking part of the whole program is when someone has to come up and walk on this stair. This right here. Right there. It's like if you've seen the movie Free Solo with the climbing, it's like that right there. So be careful is my point. Well, tonight, of course, we will celebrate this year's Global Health Impact Award winners and the hard work and dedication of global health professionals, as we know, often goes unrecognized, but not tonight. We are here to honor the incredible impact that the global health community makes on lives around the world and to highlight the achievements of this year's award winners. Now, before we proceed with the program, we want to take a moment to honor a dear friend and colleague who passed away. On August 5th of this year, the global health community sadly lost Dr. Stefan Wallace, a visionary leader in community engagement and public health. Dr. Wallace was a research epidemiologist and a public health and social justice leader with more than 20 years of public health experience with diverse populations, and he was among this year's distinguished nominees for the Luminary Leader Award. He was the Director of External Relations for Fred Hutchinson Cancer Center's HIV Vaccine Trials Network, and he had faculty appointments at Fred Hutch, the University of Washington, and Yale as a staff scientist, clinical assistant professor, and affiliate professor, respectively. In addition, he launched the inaugural Office of Community Engagement for the University of Washington Fred Hutch Center for AIDS Research. Our hearts certainly go out to his family, to his friends, to his colleagues, as he was truly an incredible person, and so I'm sure all of us are grateful for all of his contributions to the global health community. Thank you. And so with that, we will continue our program and we will celebrate you and all of your accomplishments. So to kick off our event, please join me in welcoming the reason that I bought a boat with diesel engines, but you know him as the president and CEO of the Washington Global Health Alliance, Maurizio Vecchione, everybody. Oh, you did it.
Thank you, Fred. It is, as always, sort of an honor to be in front of you. I gave you an impassioned speech last year about this time, and I was told not to do that this year. So I will be very brief. I know a lot of long speeches start that way. As you know, I wear some multiple hats, but I am the CEO of the Washington Global Health Alliance. I did want to pause for a second for those of you that just joined us this evening. We had a pretty monumental event happen just before this meeting, actually downstairs. Last year, I told you about a new initiative that we were launching called the Global Health Innovation Exchange, which was a program designed to foster innovation within the global health community. And I'm happy to tell you that today we had the first exchange meeting with the inaugural members. And there'll be a lot more said in the future about what was achieved today as a Kickstarter to everything else. Anyway, for those of you that did participate to the event earlier, thank you very much for your attendance. And we are quite excited to see the possibilities. Before we continue our program, I'd like us all to take a moment to ground ourselves and to respectfully acknowledge the land where we are today. For those of us here in person and tuning in from the Seattle area, we acknowledge that we are on unceded territories of the Coast Salish people, including the Duwamish, past and present. We invite you to learn more about the tribal land you occupy and to truly commit through words and action to demonstrate respect, support, and rights to the true owners and caretakers of these lands who are still here today. I would also like to take a moment to congratulate all of this year's finalists. It truly was an exceptional group, and I would say every one of our finalists are winners, regardless of our acknowledgement. The selection of our finalists was extremely competitive and reflects the importance, value, and impact of your work on behalf of the entire global health community. We're honored to be here with you this evening. To all of our guests, thank you for your presence at today's gathering. We are grateful to have each one of you here with us, celebrating the contribution and achievements of the global health community as a whole. Tonight, we're very honored to have our Luminary Leader finalists from last year. Washington State Secretary of Health, Dr. Umar Shah, is here with us today. Please join me now in welcoming him to the stage.
I think it's just better to bypass that whole two steps thing and just go straight to the top. So thank you, Maurizio, for allowing me to speak and also the kind introduction. I really want to thank all of you. It's fantastic to be here. And I do want to our MC, say that I think you said 45 minutes on the parking rotation. It was actually more like an hour and 45 minutes. So just to be clear here, just noted. So just great to be here, and thank you so much. And you may be asking why exactly, as the Secretary of Health for this great state, that I am here, and I am telling you that it is so important that we remember the incredible connection between global health and domestic health. What happens across the globe, what happens across our state, what happens in this community is absolutely bidirectional. We have to be thinking about those connections every single day. So I want to just make sure to say that. I also want to, before I forget, just recognize a couple of people. I'm going to not be really good with names, but I will say Maurizio, I said, Megan, Alana, and Prabha is, oh, there you are. I didn't know where you are. If you could just join me in really putting your hands together and thanking them for the incredible leadership that they have provided. And to their teams, because putting an event like this, I've been, and I know all of you have been involved in planning, it takes a lot of effort, a lot of real work to make this successful, and absolutely, I want to say thank you to WGHA. We at the State Department of Health, and I do think I now know, somebody told me how to do this. Yes, look at that. Ooh, it changes the whole mood, right? Lower the lights. Look, now we at the State Department of Health are so excited to be part of the Washington Global Health Alliance. When I stood before you last year, we were not really a member at that point. We were interested, it was nice, there things that we had done tangentially, worked together, but we were not a formal member. And I want to tell you, advanced 1 year, and we are now a formal member of the Washington Global Health Alliance. And we believe, thank you. We believe so strongly in the importance of connections like this. And I will tell you that that is something that has really gotten us through as a state. Remember, we were the first state in the continental United States with a case of COVID-19 in Snohomish County. We had the first outbreak, if you remember the nursing home. We had the first death. You remember that was such a hard, difficult time for all of our community members. And fast forward 3 years later, we have one of the lowest death rates from COVID-19. That could not have happened unless we all work together and for convenings like this. So just can't say enough about the connection and why all of us are so critical to the process. So I don't want to bore you with slides because this is not I'm going to be like the Debbie Downer of the evening, like, oh, I've got some slides. And you're like, oh, why did I come this evening? The MC was so good and it just went down. I'm not going to do that, but I am going to show some real images because I want to actually frame where we are as a state health agency and why this work is so important. So first of all, you see the Space Needle. You understand and recognize that when you come to this community, how it is viewed across the globe. That people think about the state of Washington, they think about Seattle, they think about the ecosystem of health in this community, and they think about it as innovative, they think about it as equity-driven, and they think about it as collaborative and engaging. That is what we are known for across the globe. And it doesn't surprise you that these are the cornerstone values for our agency. We believe that health is the intersection of equity, innovation, and engagement. It starts and centers with equity, all the communities in our great state, but we can't just stop with centering with equity. We have to do something about it. We have to actually take theory and make sure that we implement the work that we do. And it's about innovation and not just the tools, because that's the immediate thing that we do in this state because we have all these great tech companies. I think some are represented here, so no offense. Please don't throw, if you throw something, make sure it's fruit, make sure it's vegetables, please nothing bad, no donuts. But throw it my way, that's okay. But to say that we are absolutely about innovation and tools and technologies, but it's really about the creative space for our people to be able to do that work as well. And then engagement, that we cannot do this alone. We must all be part of the solution. And we do believe very much that global health and One Health, and I mentioned One Health in a little bit later as well, that it's so critical to the work that we do. And you know this, right? We know it's about migration and travel. We know it's about infectious diseases and we're a plane ride away, or it's about the challenges that we have from climate and how that impacts us all across the globe, cybersecurity, the concerns that we have not just about information exchange, but misinformation exchange that do not know borders, that ultimately they're all about everything that we do. We know that public health challenges and solutions do not recognize borders. We have to be interconnected. Thank you. We have to be interconnected from the chronicity of disease, the conditions, the environment, infectious diseases, technology, everything that comes together to make sure that we are working across systems, because ultimately that's how we are effective in the work that we do. Just a reminder, there is public health, there is global public health. To me, it's all health. It's all health. And we have to be thinking about those systems and how do we work across those systems so we can promote the work that we do. And so, not surprisingly, and I'm not going to go long, so Mauricio, please don't get upset because I'm about to finish and just like a big bang here. Big bang here. Here we go. Here we go. Are you ready? All right, well, I'm not quite there. Is that we're doing a lot at our department. And I want to recognize a couple of people that are here in the audience. First, Dr. Bryant Karras. Dr. Karras with the hat. You haven't met Dr. Karras? He's our Chief Medical Informatics Officer. And Dr. Karras is somebody you need to know. If you don't know him yet, please get to know him before the end of the evening. And I also want to recognize Chris Holliday, who's our Chief of Strategic Partnerships. Chris, right there. Chris has done global work in Angola and other places, and a lot of real excitement about the work that we do. When we look at all of the different things that are happening across our agency, we recognize the importance of the work that you see up here. But I want to call out a few things. Dr. Karras and I, we went to Spain as part of the G20 meeting last year. It was really a high-level meeting that the G20 put together for understanding and underscoring the need for safe travel, international travel, across borders. And so we were so proud, and Washington State is not a nation state, just remember that, right? We're part of the United States. But we were there recognizing and underscoring our work with WA Notify, WA Verify, and a whole host of other activities. By the way, we always put everything with WA in front. Just always got WA, you know it's us then. It's not West Virginia. You see WA, don't look at Detroit. It's not Michigan, it's us, right? Thank you. Who said that? Michigan? Yeah. No offense against Michigan. I love Michigan. I spent a lot of time there. But WA Notify, WA Verify, the opportunity for us to be able to connect with people for COVID-19. Again, WA Notify was about the systems that we had on our phones to tell people without having any ability to know who the other individual was, the ability to connect and say that you may have been exposed to COVID-19 and be able to have that person take the appropriate preventive measures beyond that. And then WA Verify, for us to have digital cards to actually be able to utilize that across the system to connect with what's happening so that we can verify immunization status. We were recently at APEC, and the real cooperation around Pacific countries, the economic cooperation that happens. And I do want to say that that is just another activity that is very much a part of what we're doing when it comes to innovation. We recently hosted with the CDC Foundation. I know Brandon was on earlier as part of the convening the CDC Innovation Summit that was here in Seattle. It's really an opportunity for us to be thinking about the work that we do. We recently had our state epidemiologist, Dr. Scott Lindquist, go to Guam, who helped with trying to design programs for tuberculosis prevention and activities, as well as very soon, I will be going with WGHA to the climate conference in UAE, and I think it's such an underscoring of the work that we do. We have to recognize that the work that is underscoring global and domestic connections is not a one-time deal. It is an ongoing, relentless pursuit. It's not a car commercial. A relentless pursuit, not of excellence, although it is excellence, of cooperation. A relentless pursuit of cooperation. Thank you. So in that mind, as we see COVID-19, not the actual COVID-19 completely out of the spectrum, but the emergency phase end, we've been saying this to many people that ultimately it is about how do we approach the work that we do. We can be transactional in nature, which is what we do as community members all the time. We go to the next shiny object, we go to the next something bright, the next headline, and we do this, and we walk away and say, we somehow solved COVID-19, which, by the way, as a nation, as a globe, we didn't quite do so great, but I'll leave that one alone, politics aside. But what I will say is that ultimately, we have to be not transactional, but transformational. We have to be thinking about all the pluses, all the minuses, everything we learned during this pandemic, and build and leverage on it to be transformational. And so, with that, we are very proud at the Department of Health to launch our transformational plan. And our QR code is there if anybody wants that and you want to see this. I have one copy here. I can raffle this off for 25 cents? I don't know. But we are the first state health agency in the nation to have global and One Health as one of its 5 priority areas. Let me repeat. We're the first state health agency in the nation to have global and One Health as one of its 5 priority areas. We are so proud of that because we believe that global health and domestic health are ever intertwined. So please join us in working together on the solutions and not just the challenges of global and domestic health, because we have a lot to learn from each other. And so with that, let me just close by thank you. I got one. Thank you. I got 2. All right, I appreciate it. I feel like an auction. I got 3. Did I hear 4? I got 5. Okay, we'll stop there. That's right. Let me close by saying that we believe that building connections can only be done when we do it together. And there are so many things to say about this, but the one thing that I would say is that as our team, as you see, this is our leadership team, as we do the work that we need to do and have to do for the health and well-being of everyday Washingtonians, we believe we cannot do that work unless we bring the connections of what's happening across the globe to our state, and bidirectionally also have those connections across the globe. So with that, this is how you get in touch with me. I hope you have a great evening. Congratulations to all of the award winners. Let's hear it for them, for the hard work. And the last thing I would say is that we are, with our global health work, we have in the midst of launching our Global One, which is our new division of Global and One Health. And we have been recruiting for a Global One director. We were supposed to hire that director in Q3 of this year. Fortunately, I was a little late in the process, so it's going to be Q4 of this year. But we are so excited to have a leader who's going to be leading our efforts for global and domestic health. And so with that, I want to say thank you again, and I hope we have a great evening. Drop anything.
Hey, take your time. Give it up again for Dr. Shah. Can we do that? See what I did? As a licensed auctioneer, by the way, you did a great job up here. I was impressed, so you're hired. And you talked about ending with a bang. Dr. Shah had requested pyrotechnics at the end, but we just didn't have it in the budget this year. But we'll get the pyrotechnics for you next year, and the Bengal Tigers. All of your requests will happen next year. All right. Now I get to welcome our next speaker. You know her as the Vice President of WGHA. Please make some noise for Megan Batillion, everybody. Safety first.
Exactly. I'm also skipping the scary stairs. So first of all, at the time I didn't even think about in the programming that I would have to follow Dr. Shah, so I'm sorry. But he is probably one of the coolest people I know, and we're really, really thrilled to have him and his team here with us tonight, and to have all of our amazing finalists and winners here. It's just such a special evening for us, and we're just delighted to be here. So I'm going to do some of the, let's call it more mundane administrative tasks, but because I'm sort of a mundane administrative person, for me, it's the fun part. First of all, I do want to start off by acknowledging WGHA's board members, because I know many of you know some of our board members, but I don't think that everybody understands what goes into being a board member for an organization like WGHA. They are absolutely incredible. They work tirelessly for us, everything from our programs committee to our finance committee, trying to help us understand and craft the messaging and put on events like this, and now with our exchange, really make sure that something like that is successful. It's really a big challenge, and they step up to it every single time. I want to specifically call out our board members. We have K.R. Prabha, Nwando Anyoko, John Aitchison, K.K. Chan, Sanjay Cheda, Drew Clark, Ria Kohler, Jennifer Eslava, Jim Kublin, and Marsha Matusi. Almost all of them are here with us in the audience tonight, so before we leave, if you get an opportunity, please thank them personally, because they're all incredible people. And I also want to put a big shout out to the WGHA staff, because let me tell you what a year it has been. We are really, really excited to be here tonight, mainly because tomorrow we're going to sleep. But the team put in an absolutely incredible Herculean effort to make this night be as special as we could, and to bring you all of the great and impactful programming that we do with WGHA. So we have Ramadan Asi, Jasmine Davis, Kayla Jan, Alana Robertson, and of course, our illustrious leader, Maurizio Vecchioni. It's also my great honor tonight to recognize the wonderful and supportive organizations that have made tonight possible. It is with deep gratitude that we thank this year's hero sponsors, Ad Astral Funds and the Bill and Melinda Gates Foundation. In 2022, the Bill and Melinda Gates Foundation funded 1,960 grants for a total of $7 billion in support. We all know how critical the work the foundation supports is to delivering health equity around the world, and we are profoundly grateful for their support. Our other hero sponsor, yes, thank you. Our other sponsor tonight is Ad Astral Laboratory. Ad Astral is a team of entrepreneurs, scientists, and investors who believe that solving global problems can bring extraordinary financial and social impact returns. They are proud to support the work of WGHA, specifically as a founding member and sponsor of WGHA's Innovation Exchange. Our Guardian sponsors tonight are GRAIL and Seattle Children's Research Institute. GRAIL is a healthcare company whose mission is to detect cancer early when it can be cured. They're developing a multi-cancer early detection screening called Gallery, a test that measures for the presence of cancer tumor DNA in the bloodstream. The Gallery clinical development program consists of studies that collectively include more than 335,000 participants around the globe. We also want to thank Seattle Children's for being one of our Guardian sponsors for tonight's convening. At the forefront of pediatric medical research, Seattle Children's Research Institute is working to cure childhood disease and improve outcomes for children all over the world. As one of the nation's top 5 pediatric research centers, the Research Institute, together with Seattle Children's Therapeutics, is internationally recognized for its work in cancer therapies, genetics, neuroscience, immunology, infectious disease, and bioethics. We are grateful for Seattle Children's Research Institute's support of this year's event. We also want to offer a heartfelt and deep thank you to this year's WGHA Trailblazers and Pathfinders. These are the unseen forces behind WGHA whose generous gifts help underwrite some of the less glamorous parts of our work. But we thank them very, very much for their support. And also, thank you to tonight's incredible event partners, such as the Burke Museum, right? How incredible is this place? And we know the whole parking sitch, okay, maybe not great, but that's not the Burke's fault, really. But anyway, they've been incredible. We were here last year. We're probably going to come back again next year. They are amazing to work with. This is an amazing museum, and we're so fortunate to have this as an option for us to be here. And we really especially want to thank Jeanette, who helped us coordinate the event. And don't know if she's still here, but she's the event coordinator, and she's pretty cool. Off the Res, I don't know if anybody had a chance to enjoy the food tonight, but Off the Res was the caterer. They're right here. They're located right here, and they are an absolutely amazing organization, and we're really, really glad for their delicious food. And of course, if you turn around to the back, our AV technician, Lucas. Thank you, Lucas, because you are awesome. Our video editor, Jai, which you'll see the video in just 1 minute. And then, of course, to the eminent, amazing, wonderful Fred Northrup. Fred Northrop Jr., who has been with WGHA and in some capacity or another as we've evolved through these events for 10 years? Yeah. That is some serious dedication. And y'all, if you've never talked to Fred, he's hilarious. So I highly, highly recommend saying hi to him. And also, this is kind of his gig. So if you've got a gig, talk to Fred. All right, so without further ado, we're going to go ahead and turn it over to the WGHA fan favorite. It is our segment of the night, our community video.
Hi, my name is Dr. Umair Shah, Secretary of Health for the great state of Washington, and I want to congratulate all of you for being here this evening. This is an opportunity to celebrate the interconnection of global and domestic health, and we know how important that work is. That's why at the Washington State Department of Health, we're the first state health agency in the nation to have Global and One Health as one of its 5 pillars in our new transformational plan. We know what happens in the state of Washington has impact across the globe, and what happens across the globe has impact on everyday Washingtonians. Thank you for everything you do on behalf of our communities here in our state, as well as across the globe.
Despite making significant gains in reducing newborn deaths, data show that Uganda is not on track to reach the Sustainable Development Goals for maternal and newborn mortality. To address this challenge, we have developed Adara Newborn as an innovative approach to cutting newborn deaths and stillbirths in half across 10 health facilities in Uganda over the next decade. Adara Newborn addresses the quality and availability of services across the continuum of care. It also utilizes a regional hub and spoke model that can be replicated nationally and internationally. We're proud to have recently started work with our 3rd Adara Newborn site at Luwero Hospital in central Uganda.
International Medical Corps has been delivering medical relief and training in remote and difficult conditions around the world since 1984. We've faced many challenges over the years, and one of them being how to efficiently track the last mile delivery of medications. We couldn't find a commercial product to help us with the challenge of the last mile. So at International Medical Corps, we developed our own software solution. We call it the Pharmaceutical Information Management System, or PIMS. So our PIMS application is improving the way that we manage pharmaceuticals at the last mile. It is providing better health outcomes for our beneficiaries through rational prescribing, helping our pharmacists better manage inventory, as well as a reduction in paper, which contributes directly to the carbon footprint. Through our PIMS application, we were recently able to provide a Ministry of Health in Eastern Africa with the procurement needs to meet the high demand of malaria medicines in specific parts of the country. Now, without this data, they would have just bought a lot of medicine and pushed it out. With PIMS, they are actually able to focus and target the populations who require those medicines. They were obviously blown away.
Hi everyone, my name is Natasha Falcone and I'm a junior faculty here at the Terasaki Institute. Here at Terasaki, our mission is to invent and foster practical solutions that will restore and enhance the health of different individuals. We work together in a multidisciplinary environment of scientists, engineers, clinicians that collaborate to solve problems as well as translate our scientific knowledge into real-world solutions. In the past year, we have developed shear-thinning biomaterials to treat cancers and hemorrhages. We have also used tissue engineering techniques to solve hunger and environmental problems with cultivated meat. And we developed personalized models to be able to do drug testing as well as understand biological mechanisms for different diseases. To promote the exchange of ideas and knowledge, the Terasaki Institute fosters collaborations from different institutions and individuals across different countries and research labs. These partnerships facilitate the exchange between ideas, knowledge, and expertise And by bringing together different perspectives, our organization can address health problems more effectively.
As founding member and sponsor of WGHA's Innovation Exchange, Adastral has been introduced to member organizations with great ideas for projects and programs that we are now looking to invest in. As a social impact venture studio, Adastral seeks to build companies that deliver a double bottom line. I am happy to report that we already have begun discussions with member organizations and are excited to be part of this amazing ecosystem that creates solutions aimed at some of humanity's biggest challenges.
This year, Fred Hutch adopted a set of 7 values that are grounded in principles of diversity, equity, and inclusion. The values are collaboration, compassion, determination, excellence, innovation, integrity, and respect. We're now doing performance evaluations where every employee needs to describe how they've worked toward these values, and their supervisor will evaluate the efforts. The descriptions of these values include phrases like demonstrating active listening, inquiring, seeking out and valuing diverse perspectives, getting curious, seeking and fostering transformative ideas, and listening with an open mind. I think that implementing a set of values like this across the entire workforce is really the embodiment of exchanging ideas, and innovation is sure to be one of the results.
Wasn't that great? All right, thank you again to all of the volunteer participants, and thank you, as you heard, to our video editor, Jai, for producing that amazing video. You also mentioned Lucas back there. No joke, Lucas, have you seen the people who, they play the guitar and they've got an accordion going and they're drumming at the same time? Lucas is literally back there switching slides, switching between the 3 cameras for the YouTube broadcast, mixing audio, rolling video. It is insane. I don't know how it happens, but thank you for what you're doing for us tonight. Well, now it's time, my friends, to introduce our 2023 Global Health Awards finalists. We're going to begin with our Organizational Impact Award. Now, the Organizational Impact Award was judged by evidence of better health outcomes and impact relative to organizational size and budget, to innovative approach, deference to local leaders, and collaboration among diverse partners. And this year's finalists are Adara Group, Health Volunteers Overseas, and the Max Foundation. Health Volunteers Overseas improves the availability and quality of healthcare. They do this through the education, training, and professional development of the health workforce in resource-scarce countries. They envision a world where all people have access to quality healthcare, working to achieve health for all by educating and supporting health workers. The Max Foundation's mission is to accelerate health equity. They do so by delivering medication, technology, and services to patients facing cancer and other critical illnesses. And the Adara Group envisions a world in which each and every person has access to quality health, education, and other essential services, no matter where they live. Adara has expertise in maternal, newborn, and child health, and remote community development. They've worked in Nepal and Uganda since 1998. In that time, they have touched the lives of more than 600,000 people living in poverty, as well as countless others through their knowledge sharing. With 25 years' experience developing models of excellence, they are now scaling their work through Adara Newborn and Adara Remote to transform even more lives. Friends here and watching around the globe, here we go. You can picture me ripping open the envelope like they do. Yes, so this year's judging committee has selected as WGHA's 2023 Organizational Impact Award winner, Adara Group. By the way, I will note that there was a lot of conversation about Adara versus Adara, and I heard in the video, Adara. But There might even be, okay, I'm getting the thumbs up. All right, good. So now I would like to invite Brooke Magnuson, Global Health Director of Adara Group USA, to take the stage and accept the award and share a few words with us.
Wow.
All right, come up here, so Jasmine gets your picture.
It is an honor to be here tonight to accept this award on behalf of Adara and also to share this stage with such champions for health equity. First and foremost, I want to thank our teams around the world, starting with our Seattle team over here. We are very small, but we are mighty. I also want to thank our teams in Nepal and Uganda. Behind every story, behind every data point, there is a passionate and dedicated team that makes this work possible. Though he cannot be here tonight, Daniel Kabugo is our inspirational country director in Uganda. And he really should be the one that's on the stage here tonight, but he's working hard in Uganda. And he recently shared with us, we need to do what we can every single day to save one life at a time. And I could not agree more. I also want to thank our partners, University of Washington, PATH, Seattle Children's Hospital, WGHA. Because of you, we are able to achieve more. This award comes at a really crucial time for us as we are scaling our Adara newborn work. This work is more critical than ever as newborn conditions have become the leading cause of death across Africa. We know that to save a baby's life, we cannot just wait to intervene when that baby needs critical care. We actually need to intervene much earlier. And that's why the Adara newborn model ensures care during pregnancy, during and after delivery, even following mom and baby up in the community after they've gone home. This model has increased survival for moms and babies, and we are now scaling this work to 10 facilities across Uganda. We're also looking for partners, so if anybody is interested in learning more, please come grab me afterwards, and I would love to chat. Thank you for standing with us as we fight for moms and babies in Uganda and across the world, especially for small and sick newborns who do not have a voice. On behalf of the Adara Global team, thank you to Washington Global Health Alliance for recognizing this work. Together, we can make a difference. I encourage all of us to learn more about what we are all doing, and hopefully even more partnerships can begin this evening. Together, we can make a difference to improve health around the world, as my friend Dan Kabugo says, one life at a time. Thank you.
Thank you, and congratulations again to Adara Group, this year's 2023 Organizational Impact Award winner. We're so grateful for your contributions to the global health community. And I will say on a personal note, you asked, or mentioned that I've been here every year for 10 years. It's including when we were virtual. It's because it is so impressive and inspirational to hear firsthand all of the work that you're doing. So it's, as a guy who holds a microphone for a living, thank you for what you are all doing. So with that, we now move on to our 2023 Luminary Leader Award. This award is given to an individual who has demonstrated exceptional leadership and a relentless commitment to the global health community. Selecting this year's finalists and award winners, as you heard from Maurizio, was a very difficult task, and we're incredibly grateful to the judging committee for their work reviewing all the nominations for this year's award. So this year's finalists include Trevor Bedford, Professor of Human Biology at the Fred Hutchinson Cancer Center, who almost has as many Twitter followers as Taylor Swift. Alice Imasu, Executive Director of the Terawode and Terawode Women's Community Hospital, and Zakayo Ngoma, President of the Association of Zambians in Seattle, Washington. Now, in selecting the recipient for this award, this year's judging committee looked for evidence of demonstrated impact on improving health equity and scale, legacy impact on their field, championing and driving collaboration, and meaningful mentorship. And this year's Luminary Leader Award goes to Alice Imasu. Congratulations to Alice for all of her work with Terawode's Women's Fund. Alice, unfortunately, is unable to join us in person for this year's event, but through the magic of technology, I'm looking at you, Lucas, we have Alice via video. So let's hear from our Luminary Leader Award winner.
Hi, everyone. It's such a great honor for me to receive the Luminary Leadership Award. I'm so thankful to the Washington Global Health Alliance community for identifying me and recognizing me with such a prestigious award. It's sad that I'm unable to be with you here physically, but I'm so grateful to the Board of Directors of Terawoda Women's Fund for ably representing me today at this event. Here at Terawoda Women's Community Hospital, the women who are suffering from obstetric fistula and other childbirth injuries walk in and receive quality care, free without paying any money. Our program has been designed in such a way that we recognize that fixing a fistula alone does not solve the problem for many of the women and girls. Because of the stigma, the abuse, and all forms of social injustices that the mothers are exposed to. We have designed an individualized reintegration program that empowers the women following treatment, that educates the former fistula patients, that prepares them and equips them with skills to go back to their communities and live a dignified life. We support these women and make connections that enable them to become agents of change for better maternal health outcomes in their communities.
Congratulations again to Alice for all of her work with Terawode Women's Fund. I'm sure you will be watching the YouTube stream. It will be posted for you. And we have Terawode's Women's Fund Board President Carolyn Anderman here with us tonight to accept the award on Alice's behalf. Please welcome her. Sure, you get a picture with right there. Thank you.
Thank you. It is an honor for me to accept this award on Alice's behalf. And I hope to be in Uganda next year, and I will personally deliver this to her. As was said, I serve on the board of Terawoda Women's Fund, which is a US-based organization that is dedicated to supporting Alice and her incredible work to restore dignity and opportunity for women and girls who have suffered with obstetric fistula and other devastating childbirth injuries. So we would like to add our thank you to Washington Global Health Alliance for recognizing and honoring Alice and her great leadership in the global efforts to really eradicate obstetric fistula and make childbirth safe for all women, wherever they live. So thank you.
We'll leave it here and come again. Thank you. Well, last but certainly not least, it is time to recognize our finalists for this year's Rising Star Award. Now, this year we had an incredible lineup of finalists for this Rising Star Award. The Rising Star Award is given to an individual aged 40 or under who is making an exceptional impact in the field of global health. I'm told that me being over 40 is the only reason that I wasn't nominated this year. So we are grateful for all of our nominees and finalists for this year's award. Our finalists this year are Ritu Kamal, Associate Director of Global Programs at the Stanford Byers Center for Biodesign. Thanasis Vradimos, Founder and Board President of GiveMed. And Kingsley Ndo, Founder and Chief Strategist at Huroni AI. After extended deliberation, the judging committee has selected as this year's Rising Star Award winner, Kingsley Ndo. Congratulations, Kingsley. If you'll pose for Jasmine.
Thank you so much.
I'll move this out of your way.
I am so honored to be here. Thank you, everyone, for making the sacrifice to be here. Thank you so much to WGHA and all the sponsors of this event. It's truly an honor. This is a testament to the work that the Huron AI team does every day. I want to thank also our partners, Amazon Web Services, and all the cancer centers we're working with in Africa and Latin America. You know, at Huron AI, our vision is to make AI-driven precision cancer care available to everyone, everywhere. And we're doing that by using regional data, local treatment protocols, generative AI, and tools that can help deliver care and automate processes for oncologists and help patients to have remote care. Losing my aunt many years ago is one of the drivers for me to do this work. We have been supported by amazing partners and companies like Amazon. And right now, we're raising a seed round to continue our global scale into Nigeria, Kenya, and Brazil. We have co-investors. We're looking for that lead investor. But we want to continue this work and ensure that with the innovation that's going on in artificial intelligence space, underrepresented populations whose data are oftentimes not used to train these applications are being incorporated, and so that we can continue to close the divide. We really want to make health equity in cancer care a tangible reality in our time, and we're very ready to do that, and we'll continue to do that work. And this award definitely fuels us to continue on that path. Thank you so much, everyone. I'm truly honored. Thank you. I appreciate all of you.
Thank you, Kingsley, and congratulations again on your Rising Star Award. Well, this year's judging committee also wanted to recognize Thanasis Vradimos as a special mention for this year's Rising Star Award. Thanasis has done incredible work as the founder and board director of GiveMed, a nonprofit organization that aims to give people direct access to all of the medicine that they need. And with his team, by making use of technology, they make medicine donation easy for everyone, highlighting the need for a society with social solidarity. Our judging committee wanted to make sure to recognize his contributions to the global health community tonight. And now I'd like to pass the mic to WGHA's board chair, the one and only. Please welcome Prabha. There, well, you did it.
What skills I have there. I'm trying to. Perfect. Well, firstly, thank you all for coming in on a weekday.
Lower that down. There we
That good? Okay. And then I'm just going to make a couple of gratitude comments here. But it was really nice to see everyone, and it's a full house, as Fred said earlier. So we're very excited with all the work that we're doing at WGHA, and we are so glad to see you as our partners. So thank you for your generosity, and congratulations again to all our finalists this year and our winners as well. All of you have made incredible contributions to the global health community, and we are truly honored to be celebrating your achievements in this evening's award ceremony. I'd also like to take a moment to recognize our judging committee, and their work was not easy. We had amazing nominations and lots of good deliberations, but I think our committee, as you can see up there, had a diversity of experience and expertise working in global health, in public health, and in just health. And I think that helped us identify, even though it was difficult, our winners for today. So thank you again to this year's judges, my colleagues John, KK, Ria, and Megan. Thank you. Finally, we would like, on behalf of WGHA, I'd like to thank each one of you for being here today. Your ticket purchases have helped us continue our mission of connecting and informing, which is core to everything we do, and helping keep the global health community current and connected. And now I'd like to pass the mic back to Fred, who officially will close out the evening for us all. Thank you.
That was very brave.
I did it.
You did it, I know. Makes me nervous. If we raise enough money this year as a group, we can afford to buy the Burke a new stair. Well, as Prabha mentioned, thank you again, all of you, for your support of WGHA. If you would like to further support the mission, you can make a donation by visiting wghalliance.org/donate, or you can use the QR code right there, the magic of technology. That QR code is on the screen for you right now. Friends, my name is Fred Northup Jr. It has really been so much fun to be here with you. I know it's a school night, so I want to let you go. But first, congratulations to all of our 2023 Global Health Impact Award finalists and winners. Let's give them all a round of applause. And we're so grateful to each and every one of you for being here. We will see you next year. Good night, everybody.